Since AIDS became part of our collective vocabulary some 30-plus years ago, the fight to remove the social stigma surrounding the disease has been almost as tough as the battle to prevent the spread of the epidemic. There have been pervasive global public awareness campaigns and grassroots education initiatives. They've been led by non-government organizations, healthcare providers, and celebrities. Those efforts have led to a better public understanding of the causes of the disease and its victims. But as full-frame contributor Sandra Hughes found out, even though the face of AIDS has changed in recent years, the social experience of living with the disease is still a daily struggle.
John Dennem-Tigner knows how to keep a secret. He kept his fatal medical diagnosis quiet for years while serving in the military.
I enlisted in the Navy when I was 17.
His commanding officers knew he was gay. Still, he tried to keep that a secret, as well as the fact that he was HIV positive, diagnosed in 1986 while serving on a submarine.
I was the lookout.
His direct superior delivered the then dire diagnosis.
I said, "Am I going to die?" And he said, "I don't know." And I just fell apart. I cried for maybe 10 minutes, and he didn't say or do anything. He just let me do that.
Back then, the virus that causes AIDS didn't even have a name.
It was called HTLV3. It hadn't been isolated yet. They just knew that it was a virus that was affecting the immune system.
When he was diagnosed, he was taken off the sub and sent to a naval hospital. It was a lonely, excruciating journey.
4 or 5 days later, my mother showed up, and my mother was the first person in 2 weeks that touched me without a glove. It was so shaming, and I couldn't tell anybody.
Dennem-Tigner was later diagnosed with AIDS, but treatment with antiretroviral medication, now reduced from about 10 pills a day to 1, has decreased his viral load and slowed the progression of the disease. 3 decades ago, John says even the gay community abandoned him. Now he sees some attitudes changing.
The way society responds to HIV is different. There's more compassion in the providers. I think that's changed. The personal experience, the personal shame has not changed. The stigma is still there. The stigma is there because in the United States, HIV is a gay man's disease.
Dennem-Tigner should know his master's thesis was on society's bias against homosexuals.
My name is John. At the age of 22, I found out that I was HIV positive, and 7 years ago, I was diagnosed with AIDS.
He wants to erase the prejudice by raising public awareness about the disease.
When I got out of the Navy, I didn't seek employment from a private employer. I tried to create my own jobs because I didn't want to divulge that I was HIV positive.
He works with the Life Group LA, which educates newly diagnosed patients and their families. Every year in the United States, 50,000 people are diagnosed HIV positive, and that rate of infection hasn't changed in about 20 years.
Hi, Mark. Hi, Classy. How are you?
Dr. Jay Gladstein is an infectious disease specialist.
So, Mark, how you doing? I'm good. It's time for blood work, so I thought I'd come in for that.
He no longer delivers a death sentence to his patients when they are diagnosed as HIV positive.
Pretty good. Took a few deep breaths.
But he says only about 80% of those infected in the United States know they have the virus.
Okay, perfect.
A smaller percentage are actually, they may know they're HIV positive, but a smaller percentage, actually about 60% of the total, are getting any HIV care.
We'll step in the room 3 with you.
It's very frustrating.
Doctor's office, can I help you?
Healthcare providers say that with proper treatment, HIV and AIDS can be just another chronic disease. There is even a new drug aimed at prevention. It's called Truvada.
We know it works very, very well if taken every day, if taken as prescribed. But we are not yet, I think, at a place of having the medical infrastructure available to prescribe it in the most effective way. So I think we need to have a lot more education, both of medical providers and in the community.
Overall, the global attitude within this cohort...
Spreading the word about HIV and AIDS, which he once felt compelled to keep secret, has brought new meaning to John Dennem-Tigner's life after decades of doctors and drugs and medical testing.
I have this fairy tale wish that 50 years from now, this will be a non-issue.
Nearly 30 years after he was diagnosed with HIV, he says there is still a stigma, though for him at least, its sting is less sharp. For Full Frame, this is Sandra Hughes in Los Angeles.